Last point, and this is a personal point, when is it over? I have this conversation 100 times a day. I had it last night with my daughters. When is it over? And it's a difficult conversation because people want it to be over so badly, right? I want the fear to stop. I want the anxiety to stop. I don't want to have to worry about my brother anymore. I don't want to have to worry about my daughters. I don't want to have to worry about my mother. I want it over. I want to get out of the house. I want to get back to normalcy. I've been living on this weird, disorienting, frightening place. I'm afraid to touch people. This is it violates the human behavior and needs. When is it over? It's not going to be over like that. It's not going to be we flick a switch and everybody comes out of their house and gets in their car and waves and hugs each other and the economy all starts up. I would love to say that's going to happen. It's not going to happen that way. It can't happen that way. Can it happen in some communities across the country where, frankly, they have very low infection rates? And they could come up with a testing regimen where if they find 1 or 2 cases, they quickly jump on those 1 or 2 and they isolate and they track? Yes. But is that going to happen here? No. Is that going to happen in any community that has a significant issue? No. There is going to be no epiphany. There is going to be no morning where the headline says, hallelujah, it's over. That's not going to happen. What will happen is there'll be points of resolution over time. What does that mean? There'll be points of resolution. There'll be points where we can say we've accomplished something, we should feel better, we should feel more calm, we should feel more relaxed, and it will be incremental. We're controlling the spread. We are controlling the spread. You look at those numbers, you know what it says? We're controlling the spread. I was afraid that it was going to infect my family no matter what I did. We're past that. If you isolate, if you take the precautions, your family won't get infected. We can control the spread. Feel good about that. Because, by the way, we could have gotten to a point where we said, we can't control this damn thing. We can't control it. It's in the air. It gets into your house. It doesn't matter. You close the door. It comes under the door. You could have gotten there. We're not there. Those numbers say we can control the spread. Feel good about that. The worst is over. Yeah, if we continue to be smart going forward, because remember, we have the hand on that valve. You turn that valve too fast, you'll see that number jump right back. But yes, I think you can say the worst is over, because the worst here are people dying. That's the worst. The worst doesn't get any bad than this worst. And this worst is people die. That's the worst. And Winston Churchill, I mentioned the other day, the end of the beginning. Yes, we can control the spread, and we can reduce the number of people who die, and our healthcare system can do phenomenal work and rise to the occasion and deal with this beast. It has not overwhelmed the healthcare system. We have controlled the spread. And there is confidence to be taken in that. And that's an accomplishment. And it was a heck of an accomplishment. Those healthcare workers, for the rest of my life, I will say nothing but thank you to them. And I was not sure that we could keep the tide from overwhelming our hospital capacity. And they did. Feel good about that. And I believe the worst is over if we continue to be smart.